This week's news was defined by a single clarifying lesson: a virus that experts already understood behaved exactly as expected. And yet the response around it exposed a lot of fragility in both America's and the world's public health, infrastructure, and the media environment around it. The hantavirus outbreak on the ship was not a mystery. The Andes strain is known, its behavior documented. Person to person spread, while rare, is not new science. What was genuinely alarming wasn't the virus. It was one, seeing the US CDC basically on the sidelines without a CDC director, without a director for the National Center for Emerging and Zoonotic Infections, really not communicating that much in the early days with the general public. And the response being led competently by the World Health Organization, of which the US is no longer a member. It's also the fact that the media handled this very differently. It seems that there's two speeds to deal with infectious disease story. It's zero or apocalypse. And that feeding frenzy is something I'll talk about a little bit later. But while the hantavirus dominated the news, vaccine preventable illness, measles, continued to make inroads in the United States, including in my home state of Pennsylvania, as well as places like Arizona, Wyoming. We read stories about H5N1 being found in aerosolized in milking parlors. How many H5N1 human tests are being done for avian influenza? Probably not very many. And the World Cup is about a week and a half away, and there's data showing that half of our states can't handle the emergency preparedness needs for the World Cup and the mass gathering that occurs. So the theme of this week isn't one virus. It's what happens when public health infrastructure is hollowed out all at once. Going to start with the hantavirus outbreak, which has been dominating the news, including now, and will probably for the next couple of days at least. So what happened? The MV Hondias, a Dutch-flagged ship, embarked from Ushuaia in Argentina on a trip to Antarctica, some other islands, and during that voyage, cases of hantavirus occurred. The first one wasn't even known to be hantavirus. They thought the person died of natural causes. This was a birder who likely contracted the virus in Argentina, where the virus is endemic, where there have been over 101 cases reported since June 2025. They're in high season, and infected other people. The total number right now is 8, and it does appear that all of those 8 had relationships with each other in some way that would put them into close contact. There have been 3 deaths, and now the ship basically was unable to disembark passengers at the Cape Verde Islands. I think that was a mistake. I think you wanted to get those passengers off as quickly as possible and decrease the temperature here. But the Cape Verde Islands said that they didn't have any medical capacity, which is probably true. And that allows them under the international health regulations to not allow those people to disembark. But these weren't sick patients. None of those passengers that remain are ill. They're all asymptomatic. This could have been handled there. Then they went to the Canary Islands, where the regional government put up a little bit of a fuss, which was quickly quashed by the Spanish government, which controls those islands. And now passengers are disembarking in the Canary Islands, being screened, being repatriated to different parts of the world that they originate from. The ship is then going to go to the Netherlands and be disinfected. The Americans, there's about 17 or so Americans on board, are being met by a CDC team. Thankfully, the CDC has sent people there. And they're going to be taken to Nebraska, where they will be screened and undergo some process of monitoring, probably in their homes. And this is something that can be done. State and local public health know how to do this. They did this in 2014 with a higher consequence infectious disease, Ebola, with healthcare workers. And they're already doing that for about 7 or so Americans that disembarked earlier before there was a known hantavirus outbreak on that ship. And what they'll do is basically monitor their health, check in with public health. They may take their temperature a couple of times a day, and they're going to be in places that are able to get them care quickly if they need it. And especially because hantavirus can be very severe with a mortality rate of about 35%, they need to be in places where there are ICU level care. ICU level care is promptly available, including heart-lung machines, that type of thing. So that's likely what will dominate the news in the coming week, is how these 17 Americans or so fare. There was one case of somebody who did get off earlier in that early disembarkation and was in Switzerland. And he responded to an email and was sick and ended up getting hospitalized in Switzerland with hantavirus there. So that 8th case was someone who'd already disembarked from that. That's the only one thus far. There's been lots of rumors about this flight attendant, that flight attendant, they all seem to be testing negative. People who had contact, which fits with it because this is a virus. Yes, it has the ability to transmit between people, but not very easily. So moving on to some of the science of hantavirus that's happened in this last week. So we figured out that this is the Andes version of the virus. South Africa had done a really great job at sequencing and understanding that this was the Andes variant. They've looked at the strain to see, is it the same Andes variant that is dominant in Argentina? And the answer is yes. There's no concerning mutations here. The virus is behaving just as we would expect it to behave. And interestingly, thinking about the transmission, the WHO, I heard a spokesperson say that there were cabin mates where one person was sick with hantavirus and the cabin mate tested negative and is not sick. So that shows you that there are constraints. So why does Andes virus, why does it have the ability to transmit from person to person while all the other hantaviruses that we know of don't? It's because it likely has the ability to produce more virus in your body, a higher viral load. And that's what drives transmission. And that transmission is very constrained. It's not like influenza or COVID, certainly not like measles, probably not even like Ebola. And that doesn't mean that there's not super spreaders. And I think we'll learn about that first patient that contracted the illness off ship. Was he somebody that was a super spreader? Is he responsible for all the transmission events or not? Was there something specific about his viral load? I think those are things that we're going to need to explore and understand, but we don't quite have that information yet. There are no vaccines for hantaviruses of the New World. So hantaviruses are kind of broken into New World and Old World. Old World means Europe, Asia. New World means North and South America. There is an Old World vaccine that's available in South Korea and has been since the 1990s, but it doesn't have effect against these New World hantaviruses. And there is research going on. There is research going on in South Korea with Moderna to make an mRNA pan-hantavirus vaccine, one that will cover all the strains. There is work going on by the US military to make a hantavirus vaccine and other groups as well. But the important point is that this is all early stage research, not commercial level. And I think that speaks to the fact that even though hantavirus is all over the headlines now, it's not a major public health threat. It's not something that lures pharma and biotech to want to invest billions of dollars in to make a countermeasure. I think we will likely see that now because of the disruption, or at least the media spectacle that this outbreak on a ship has caused. But as of now, no antivirals, no vaccines. And I wanted to talk a little bit about the US response. So we have no full CDC director right now. To my knowledge, there's not a National Center for Emerging Zoonotic Infectious Disease director. That's the center where hantavirus subject matter experts are housed at CDC. And the CDC response was largely reactive. Very little information. That's picked up now. The CDC has sent a team to the Canary Islands. The CDC has put out a health alert to clinicians, which is really important. It's a way that they communicate. But it was, I would say, more reactive than you'd see. Even if this doesn't pose a threat to Americans, and I agree with the CDC that that's not a major threat to Americans, but you would like to see a proactive, robust response from what was the premier public health agency in the history of the world. But they're constrained and they're hollowed out and there aren't people there and the morale is down. And I think that's reflected in the fact that you didn't see that robust response, or that maybe that robust response needed to be cleared in Washington. But thankfully, RFK Jr. has not said anything about hantavirus. You don't want him to speak about anything, literally anything. I don't want to hear him speak about it, even if he is the chief health officer in the United States. And remember, the U.S. is not in the World Health Organization anymore. What you've seen is, I would say, a stellar performance by the World Health Organization, including the Director General, as well as Maria Van Kerkhove, who's an American that works at the WHO, who is one of their leads when it comes to these emerging infectious disease outbreaks. The Americans that are coming off the ship are again going to Nebraska. I talked about what's going to happen with the self-monitoring. We've done that before with Ebola individuals. This doesn't really pose a major risk. Nebraska, for those of you who want to know, is one of the premier places for biocontainment. They took care of multiple Ebola patients during the 2014 outbreak in West Africa. And I think that this is going to probably, hopefully, fade from the news cycle. But I think I would expect more interest in the Americans coming back to continue in the news, dominating the news cycle. The other thing is, think about the FIFA World Cup coming up soon. If this is kind of a trial run for an event that doesn't really impact the U.S. public health, and they've kind of fumbled some of the issues of it, imagine that. I just said that 50% of all states aren't really prepared. Just think about mass gatherings and how well you have to do things, how well you have to execute if something occurs there. So I think this is really, a show of how reactive versus proactive approaches should, how they differ, and how the reactive responses are left wanting and not nearly as robust as proactive responses. Wanted to move to measles. So, although hantavirus is dominating the headlines, measles was continuing to spread. Active outbreaks in many states, including in my home state, where 11 cases were announced in Lebanon County, and that takes the Pennsylvania total to 23. I did some digging, and I think that might be the highest case total since 1991, when there was a major outbreak in Philadelphia that killed people. So I think that this is kind of a sign of the times. The Florida outbreak seems to be waning, but cases are still occurring. Arizona, especially in Maricopa County, has 13 cases in multiple exposure sites, so I expect Arizona's numbers to go up. Utah, Wyoming, South Carolina, a different outbreak in South Carolina. California, and particularly California, is interesting because two infants were infected before their first MMR dose. Remember, the first MMR dose is around 12 to 15 months. So there's that window of vulnerability. These two infants traveled internationally and got exposed. And that can be very difficult to deal with because measles can be very challenging in a child with no immunity to the virus, and one who is very vulnerable to illness. And I think that's something that's kind of evaded by those individuals who try to kind of deny the danger of measles. And when you look at all of those states, it leads you to the conclusion that it's inevitable that the US loses elimination status. And there was a letter in Lancet, the medical journal, talking about the benchmarks you would expect a country to be meeting if they were to maintain elimination status. And the US is not meeting all those benchmarks, which is not surprising. I had talked a couple of weeks ago, I think, about school district data on measles in the United States, what the vaccination rates are. Some state representatives in my home state of Pennsylvania, including an emergency physician named Arvind Venkat, have basically pushed to have that data public. That's something that I think should be really promulgated, that when schools advertise their college acceptance rate, their graduation rate, whatever it may be, they need to advertise their vaccination rate. So you can know if this school in your neighborhood has a 60% vaccination rate against measles. And you can then hold the school board, the school administrators, and especially the school superintendent accountable for that. Schools should compete on vaccination rates. And I think that that's making it public. And I think it is public in many places. There are dashboards you can look, but making it very visible. And maybe organizations can rate schools, saying this one has an A+ for measles vaccination, this one has an F. I think that would be really good to do, because parents need to know if they're sending their children to a safe school. And safe doesn't mean just, safe from school shootings. It means safe from measles. It means safe from pertussis. And I think that would really galvanize people to start thinking about this in a different way. Because remember, children are forced to go to school. There's truancy laws. So you're forced to send your kid to a school. You're forced to pay taxes to support that school. And then it's failing not only in the education mission sometimes, but also failing in creating a safe environment where a child is free from measles. Some other good stories about measles after that, all that negative. Wastewater surveillance proved its value again in New Mexico, where they were able to see cases in the wastewater prior to clinical cases. It predated the clinical cases. So then you can take that information to public health officials and say, we need to put out an alert that there's measles in the community. We need to put out an alert to clinicians to start looking for measles. So that's the best way that this type of wastewater genomic surveillance works. And I think you're going to see more of that come to the fore in the next years. There's no antiviral for measles, but one is in development by a company called Nanoviricides called NV387. It's a broad spectrum antiviral. It probably works on multiple different viruses. The FDA gave it an orphan drug designation, which means it's a way to kind of ease some of the regulatory burden when there's a drug being developed for a disease for which there is no treatment. And that will help maybe accelerate that development. We'll see where it goes. Maybe this will be something that helps people get better faster, prevents complications like pneumonia, prevents maybe immune amnesia, maybe prevents long-term consequences like subacute sclerosing panencephalitis, which is fatal. So we'll see what happens there. I next want to talk a little bit more about the erosion of U.S. public health. So we spoke about the fact that RFK Jr. didn't open his mouth about hantavirus, which is a good thing and we should all be thankful for. But a couple of weeks ago, during a congressional hearing, he blamed immigrants for vaccine preventable diseases, which is strange because sometimes he says that there is no such thing as, as the germ theory of disease, but obviously, he's not a clear thinker. So he blamed immigrants for vaccine preventable diseases.
If you're worried about polio and tuberculosis, you should look at the immigration policies of this country, because the places where it's occurring are the places where the immigrants are going because they're not vaccinated.
And while it's true, sometimes immigrants can have vaccine preventable diseases, I think it's really rich for him to say that because whose group went to the immigrant populations in Minnesota, the Somali immigrant populations, and spread disinformation? His did. So if how can on the one hand you blame immigrants for that, but you were the one putting all that disinformation and propaganda down their throats? It just really just shows what a creature he is. The FDA, which RFK Jr. controls, blocked the publication of information about the safety of shingles vaccines and COVID vaccines. Why? Because not only does he want to deny the benefits of the vaccines, and not only does his anti-vaccine movement want to deny the benefits of vaccines, they also want to exaggerate the harm of the vaccines. So that fits with this narrative. And it just shows you how anti-human this attack is from RFK Jr. and his people. Speaking of that, the CDC, which publishes something called the MMWR, the Morbidity and Mortality Weekly Report, which is kind of the gold standard of trying to get public health information into the hands of clinicians and public health authorities at the state and local level. They want to change it. They want to have a new publication that's more rigorous, which tells me that they misunderstand the purpose of the MMWR. They don't actually understand that it is pretty rigorous, probably more rigorous than many journals that publish. And number three, if they're controlling it, the acting CDC director and his superior, RFK Jr., even though RFK Jr. is not superior to anybody in anything in an objective sense, he's inferior to most humans. It's something that really speaks to the fact that they want to massage it, they want to change it, they want it to say what they want it to say. They want it to be a propaganda piece for their ideology and not a reflection of reality. Speaking of that, a few other negative stories. So HPV disinformation. Human papillomavirus vaccine, one of the greatest vaccines that we've ever developed. It prevents multiple types of cancer. Disinformation about it is more likely to be shared than good information about it, which I think speaks to the whole architecture of the way disinformation spreads. And it also explains why I say yes to almost any media outlet, because I'm trying to at least get good information and kind of flood the zone as much as the disinformation people. I don't know if it helps or not, but I continue to do it because I get lots of hate mail, which means I'm getting at them. And they keep asking me, why am I pushing all of this stuff 24/7? I'm not pushing anything. I'm just responding to requests. Another story, LGBTQ hostile states, meaning by hostile, I mean having legislative issues against LGBTQ people. Less pre-exposure prophylaxis or PrEP uptake in HIV at-risk youth. Not surprising that if you drive this behavior underground, if you stigmatize it, then people are going to be less likely to come forward and ask for pre-exposure prophylaxis or even talk about the need for it. And what's going on here? This is theocracy, basically. There's no rational reason to be against any of those people based on their gender identity or their sexual preference. There's no rational reason. There are irrational reasons, irrational ideologies that get codified into law. And then they actually have anti-human consequences because they are anti-human ideologies. So they will have anti-human consequences. They are examples of the anti-enlightenment. And what did they do it for? What did they get? Nothing, except for increased HIV incidence rates. So it's all for nothing. It's nihilism. And I think it's really a disgusting display. Another negative story, BioNTech, one of the pioneers of the COVID vaccine, is exiting COVID vaccine. And it's not surprising. Moderna has done similar things. What you're seeing is this kind of technological backlash. They're turning away from vaccine technologies to solve infectious disease problems. So companies are going to turn away from it too, because they'll see there's no market there. So I think that's kind of all of the stories I wanted to mention. I think that it's going to be interesting to see in the next week how the Hantavirus outbreak evolves, what happens with measles, what happens with the nomination of a legitimate CDC director, what happens to the nomination of a legitimate Surgeon General, All of that is going to be interesting things to see in the week to come.